Yeah, good morning, everyone. Well, this is okay. Yeah, you are live. Yeah. Good morning, everyone. Well, this is Dr. Pooja, your biochemistry mentor. Now, yesterday we had started up with our sessions on biochemistry, and yesterday we had started up with the chemistry of carbohydrates, part one. Okay, so today we are going to finish up with the chemistry. Now, basically, beta, what you have to, guys, what you have to study in this chemistry, in the chemistry, we have to focus on basically the structures of monosaccharides, right? Like what is the structure of glucose, what is fructose, and what is the biomedical importance of glucose and other monosaccharides. And the most important feature of this is we all know that carbohydrates are the main universal sources of energy. We are all familiar with this because whatever we have in our diet, you all know that we have carbohydrates, we have fats, we have proteins in the diet. So carbohydrates include all the parathas, you can say, yeah, what all potatoes, they are the richest sources of carbohydrates. And what happens is the moment carbohydrates enters inside the body, excess of them are converted to excess of them are converted to fat also, right? So this is how we have to see. Okay, right. Then I told you about the isomerism in the carbohydrates. Isomerism, I told you, stereoisomerism is there, optical isomerism is there, right? So what is the main difference between, let me see who all are there in the class today, right? So what is the basic difference between the optical isomers, between the stereoisomers, and I told you D and L are the stereoisomers and small d and small l are the optical isomers. Then I told you the concept of reducing sugars. Reducing sugars are very, very important. Why? Because they are basically the main abnormal constituents in urine. Okay, so today we are going to study rest of the chemistry of carbohydrates. Part. Okay, so now we studied the monosaccharides yesterday, and I'll just give you a brief introduction what all we studied. This is what we studied. We studied the anomers, in which we studied the reducing sugars. We studied the epimers, and I told you if we have to see the example, galactose is a C4 epimer of glucose and mannose is a C2 epimer of glucose. Right. So these were the two things which we studied. Then oxidation, I told you, oxidation mein what you have to remember is in oxidation, the main thing which is produced is glucouronic acid, which plays a very, very important role in the degradation of heat. Clear? And then we studied about reduction, and in reduction we studied the formation of sorbitol. Clear? So now quickly start part 2. Here we are going to study about the disaccharides. So how do we define disaccharides? It's simple: when two monosaccharide units combine. Right. So they always lose a molecule of water. And always remember, when one carbohydrate combines with another carbohydrate, it loses a molecule of water and it forms a glycosidic bond. Right? Is it clear? Is my voice audible, bachcho? Is my voice audible to all of you and the screen visible to all of you? Okay. So now let me see 1 second. Right. So if we have to define a glycosidic bond, what is a glycosidic bond? A glycosidic bond is a bond which is produced when one carbohydrate or one monosaccharide combines with the second one losing a molecule of water. Right. And if we talk about the physiologically important disaccharides, right, the most important ones are lactose, maltose, sucrose, lactulose, and trehalose. Right? So these are the important disaccharides. Lactose, maltose, sucrose, lactulose, and trehalose. So if we talk about lactose, always remember lactose is produced when one molecule of glucose which is in beta form. This is very important, and yesterday I discussed about beta form. What is beta form? When hydroxyl group is placed upwards. Alpha form is when hydroxyl group is placed downwards. So this glucose which is in beta form combines with galactose which is also in beta form, and the linkage will be beta 1 4. And always remember glycosidic linkage. Then if we talk about maltose, maltose has glucose in alpha form, right? Similarly, another molecule of glucose which is in alpha form. So obviously the linkage will be, can anybody make a guess? The linkage will be alpha 1, right? Then if we talk about sucrose, sucrose has glucose which is in alpha form and fructose which is in beta form, and the linkage is basically, you can call it as alpha beta 1, right? Or this will be predominantly beta because fructose is there. Then coming over to lactulose, lactulose may you can say galactose is there which combines with fructose, right? And this forms again galactose is in alpha form and fructose you can say it is in beta form. So the linkage can be, here it was beta 1 4. So here linkage will be simply alpha 1. Right? Or you can say it can be beta 1 4 depending upon this. But the main components are galactose, along with fructose. Then we come over to, yeah, good morning. How are you? Yes, beta. Okay. Right. And if we talk about trehalose में glucose is in alpha form. Similarly, glucose, another molecule of glucose is in alpha. Right. Now, the most important and the linkage will be alpha 1. So these are the 1, 2, 3, 4 and 5 physiologically important disaccharides. Now, if we talk about, first of all, we will talk about the structure of lactose. Okay, so if I talk about the structure of lactose, we can say that I'll just show you the structure, how it looks like. So you can have an idea that how the structure, how this galactose looks like. See, this is second. Or otherwise, what you can do is you can also start practicing the structure of lactose, because I told you yesterday that alpha 1,4 is there. So you can easily write the structure of lactose. See, this is the structure. Right? You can see here that this is galactose, this is glucose. Isn't it? This is the structure of galactose. As I told you yesterday also, galactose is a C4 epimer of glucose, isn't it? And I told you beta galactose is there, so it will be like this. And this is alpha glucose. And this is glucose. So the linkage will be like this. And this is your galactose. Right? So I can say that galactose has beta 1,4 glycosidic linkage. And what are the important characteristics of lactose? Lactose is a common, it is also basically a milk sugar. Right? And another important point is that lactose is hydrolyzed by lactase or beta galactosides. Right? And then what is the clinical correlation of this? Can anybody tell me what is the clinical correlation? If lactase is absent, what happens? Anyone? Let me see. Beta, absence of lactase. जैसे कई बार you must have heard that a person cannot digest dairy products. He cannot digest milk. He cannot digest anything related to milk. So what happens is he is lactose intolerant. So absence of lactase leads to lactose intolerance, as it is clear from the word itself. Yes, very good, beta, intolerance. And it is clear from the word itself, the person is intolerant to lactose. He cannot digest. So it cannot be broken down. So it will lead to what? It will lead to flatulence. Right? It will lead to acidity. It will start regurgitating, and it might lead to vomitings also. Or it might lead to diarrhea. Right? So lactose intolerance ko to what is the remedy to that? Okay, if a person cannot digest these lactose things, so we basically treatment is we can give him skimmed milk powder, because skimmed milk powder has more of fat in it. Skimmed milk powder is given. So this is a very important point about lactose. And lactose, which is having glucose and galactose both in beta form, beta 1 form. Then after lactose, we come over to maltose. And maltose, if we talk about the common name, it is also known as malt sugar. Right? And if we talk about the structure of maltose, the structure of maltose somewhat looks like this, or you can draw it in your notebooks also, because it is simply alpha 1,4. Okay, so if you know the structure of If you know the structure of glucose, you can draw. So this is alpha 1,4 linkage, you can see. So alpha 1,4 means that this is alpha D glucose and this is alpha D glucose. Right? So this is maltose, also known as malt sugar. Then as such, there is no correlation with this. We say normally just say all these hard drinks, they are formed of this malt. Single malt is there, double malt is there, and it will be hydrolyzed by alpha 1,4 only. Then third comes sucrose. Now sucrose is a very important sugar in a sense that sucrose is the common table sugar which we use. It is the table sugar. And what happens is if we look at the structure of sucrose, first of all, the most important characteristic of this is it is a non-reducing sugar. Very important. It is a non-reducing sugar. And what happens here is glucose is in alpha form and fructose is in beta form. So basically the reaction is between the functional groups. Right? So the reaction is between the functional groups. So they are unable to reduce. And that is why sucrose is a non-reducing sugar. Right, and I'll just show you the structure also of sucrose. This also you can try to make because I've already told you how this alpha glucose looks like and how this beta fructose looks like. Okay, so this will be the structure of sucrose. This is lactose. 1 second. Otherwise, in the meantime, you can also draw it in your notebooks. So it will be, it will give you a clarity how it looks like. Because these structures as such, so they are not asked, but suppose in case if they are asked, so you should be able to answer, right? This is sucrose, you can see. Right, you can see here if I talk about the structure 1 and 2. Okay, and since the reaction is between 1 and 2, just because of this reason, beta, we call it as a non-reducing sugar. Is it clear? So this is very important. So I can say that so it is a non-reducing sugar and you can say that it is also known as, it is also called as invert sugar. Right, now why it is known as an invert sugar? Because it appears to be dextrorotatory. This is very important. It appears to be dextrorotatory, but what happens is because fructose is more predominant. So even it appears to be dextrorotatory, but due to the more levorotatory power, there is inversion of configuration. There is inversion. Means ulta ho jata hai. So we always say that sucrose is a invert sugar. And this was first discovered by a scientist. So it's like walled inversion or invert sugar. So sucrose is typically a keto because keto group predominates. Now, if I ask you one question that I told you sucrose is a non-reducing sugar. Now, you tell me whether sucrose will give a positive OSA zone test or not, or whether it will give a positive mutarotation. Can anybody tell me? It will. No, beta, it will not give. Why? Because it will not give, because yesterday also I told you, no, ki since only it is a characteristic of reducing sugars. Sucrose is what? It's a non-reducing sugar. So how can it give a positive mutarotation or a positive OSA zone test? Is it clear? So it will not give, yeah, it will not give OSA zone test, cannot undergo mutarotation, and the most important, will not give Benedict's test. Will not give Benedict's test. Very, very important. Why? Just because of one plain and simple reason, that this is a non-reducing sugar. That is all what you have to remember about sucrose. I hope it is clear. Okay, so this is sucrose. And rest, if we talk about, these are physiologically very, very important disaccharides. And other relevant ones are, if I talk about lactulose. Lactulose is basically a synthetic derivative. Synthetic derivative, and its function is, you know what? It is a laxative. Because it can change the osmolality, right? So we use it as a osmotic laxative. Laxatives, you know, which are required, yeah, which are taken to reduce constipation. So lactulose is required for that. And instead of glucose, it has galactose and fructose. The glucose nahi hota hai, fructose is there and galactose is there. Clear? So this is lactulose. And this is synthetic. So you say synthetic means it is taken only when, you know, we want to get rid of from the constipation. And then comes trehalose. Trehalose is also a non-reducing sugar. It's non-reducing. Right? So these are the physiologically important disaccharides. Very, very important. Is it clear? I hope it is clear by now. Then after disaccharides, then we come over to, because yesterday we discussed about the classification of carbohydrates. So I told you monosaccharides, disaccharides, oligosaccharides and polysaccharides. Clear? So now if we talk about the oligosaccharides. Okay. So if we talk about these oligosaccharides, always remember they consist of 3 to 7 monosaccharide units. Right? And the most important feature about these oligosaccharides is they help in cell-to-cell recognition. Very important. They help in cell-to-cell recognition. Or you can say, like you have studied about the Singer and Nicholson model of cell membrane. ये क्या करता है? It is present on the level of the cell membrane and it helps in cell-to-cell recognition, cell-to-cell signaling, or they are the antenna-shaped molecules basically. Antenna-shaped molecules, which will help in recognition सबसे पहले, and once it helps in recognition, then distinguish between self and non-self, because this is also one of the very important properties, right? And if we talk about these oligosaccharides, we can simply say that they can combine with proteins. So if they combine with proteins, we can simply tell them that they are what? They can be glycoproteins or they can be proteoglycans. So, but they are the main components of the cell membrane. This is all about oligosaccharides. Now we finally come over to the polysaccharides. Now, if we talk about the polysaccharides, okay, these polysaccharides are the carbohydrates which have more than 10 monosaccharides, right? And these polysaccharides are basically of two main types. So we can say that polysaccharides can be homopolysaccharides, right? And they can be heteropolysaccharides. Now, what are homopolysaccharides and what are heteropolysaccharides? Now, it is clear from the word itself, homo means same. So, I can say that identical units of carbohydrates will be there, right? And here, non-identical units of carbohydrates will be there. Yeah, good morning, Rush. How are you? Today, in fact, just now I was thinking about you. Today you joined a little bit late. Okay, so we have just started up with the chemistry. We have finished disaccharides, oligosaccharides. Now we are discussing polysaccharides. Okay, so polysaccharides, poly means many, and what happens when more than 10 monosaccharide units combine, they are going to form polysaccharides. Okay, and these polysaccharides are of two types: homopolysaccharides and heteropolysaccharides. Now it is clear from the word itself, homo means same, or when identical units of monosaccharides attach, they form homo. Yeah, today as well. Yeah, so try to be well in time tomorrow. Okay, because you can connect with your phone also, beta. This is the main advantage of attending online classes. For me, though, it's like a demerit only. You are just getting up, and just putting on your mobile and just watching the classes. The best way to attend the class is have a proper seating arrangement, because while lying down, if you are listening to the lecture, it is very difficult to understand. And start cultivating the habit of making notes. This is very important, because once you start making notes, in the long run it will be very beneficial for you, and you mark my words, right? So homopolysaccharides are of two main classes. One is glucosans, again it is clear from the word, where only glucose will be there, and second will be fructosans. Heteropolysaccharides we will discuss later, right? So first of all, we are going to focus on the glucosans. Now see, only glucose is there. The only, I should say, yeah, good morning, Sneha and Shilpa. Both of you are sisters or what? Right, okay. So if we talk about glucosons, the first example, yeah, sisters, that's why you people have joined together. Okay, right. So glucosons are, the examples are starch, glycogen, right? Then the most important one, you can say cellulose, dextrans, right? Dextrins and chitin. These are the main glucosons which are present. And fructosons, the example is inulins. So let's take these glucosons one by one. First of all, we will discuss about starch. We all have studied starch. Okay, we all know that starch kya hai? It is the reserve. Yeah, good morning, Dilkush. हाँ कल वाले नोट्स इसलिए नहीं मिले बिकॉज आई टोल्ड यू वेरी क्लियरली yesterday बेटा कि once I finish up with the complete topic then I will share the notes if you remember. And I told you join my telegram group, there I will be sharing the notes with you, don't worry about that. Food energy, yes, very good. Yes, what's your full name, beta? See, can you just write your full name so that I can know you by name also? Zainab, okay. Yes, Zainab, you are right. And Dilkush, today I will finish up with the chemistry of carbohydrates, and after that I will upload the notes. Don't worry. Okay? Because if you get the notes in continuation, then it becomes easier for you also to remember. Otherwise, it's all haphazard. Okay, thanks for the compliment, Sneha and Shilpa sisters. Happy to hear this type of compliment. So you should also make us proud, no? So that once you study biochem, then after that you should say that biochemistry is a very simple topic. Vrushali, okay. But Vrush also sounds cute. So best is to call you Vrush, right? So starch is what? Starch is a reserve food in plants. We all know this. Okay. Now the most important point about starch is that it has one reducing end and one non-reducing end. Right? And starch always exists in two forms. Thank you so much for this compliment. I should actually frame it, isn't it? Thank you. Exists in two forms. And what are these two forms? Better you will get the notes. Just don't worry about the notes. Notes are not running anywhere. Till the time you are connected with us, it is our duty to provide you with the notes. ओके नोट्स कहीं नहीं जाएंगे तुम्हारे, नोट्स तुम्हें मिल जाएंगे. एंड अभी जब ये फिनिश होगा टॉपिक उसके बाद आई टेल यू टू ज्वाइन माय टेलीग्राम चैनल, देयर आई विल अपलोड दीज नोट्स. Okay, and you can join my telegram channel also. It is by the name Biochemistry by Dr. Pooja Johari, and there you are going to find so many important things related to this also. ठीक है, और बहुत सारी चीजें हैं along with this material. You will actually learn to know है क्या, what is all included in biochem. ठीक है? So it exists in two forms. What are these two forms? One is amylose and the other is amylopectin. Up, what is the difference between the two? Amylose is linear. Okay, amylopectin is branched. Right? अब linear है तो linkage क्या हो जाएगी? Alpha 1,4 हो जाएगी. Branched है तो क्या हो जाएगी linkage? Alpha 1,4 it will be there, but along with alpha 1,4 since it is branched, it will be alpha 1,6 also. Now see if I talk about the solubility. Linear and this. If I talk about the solubility, this is soluble, or I can say less soluble, but amylopectin becomes insoluble. Now, why amylopectin will become insoluble? More the branching, least will be the solubility. This is very, very important. Okay. If the, yes beta, notes aapko mil jayenge, don't worry about that. So, if the branching increases, the solubility decreases. So, always remember amylose is less soluble, amylopectin तो है ही नहीं soluble, least soluble I should say, or we can say insoluble. And we always have to heat the solution of starch. Jैसे whenever we put revive in our clothes, you know, we always dissolve starch in little bit lukewarm water just to basically make it soluble. Okay, and starch gives blue color with iodine. This is also very important. It gives blue color with iodine. And the color disappears on heating. This practical you are going to do in your first year. Those who are first prof students know, when you will go to your college, this practical you are going to do. So the color disappears on heating and reappears on cooling. Can anybody tell me ऐसा क्यों होता है? Because what happens is, this is starch. I'll see if the structure of starch is given, so it will be easier for you to understand. Because starch is completely a linear molecule. Starch is not there. But you just have to remember कि कैसे होगा, it will be like this. जैसे suppose if I am writing one glucose molecule, it is like this. Like this. Okay, and 1,6 is there, so it will be 1 and 6 will be somewhat here. Like this. This is the 6th molecule. So it will be attached with the first one, like this. So this will be 1,6 linkage, or इसको हम ऐसे भी बता सकते हैं, this is alpha 1,4, this will be alpha 1,6 like this. Clear? This is starch. Then second we come over to, after starch, glycogen. Just like starch is a reserve food in plants, glycogen is a reserve food in humans. I'll just give you one common example. जैसे suppose if you are coming and attending my class, तो तुम लोगों ने क्या किया है? You must have had your breakfast. Okay, breakfast करके attend कर रहे हो classes. तो क्या हो जाएगा कि you will start, you know, the body will slowly go into a post-absorptive stage and so on. So whatever glucose is there, that glucose will be stored in the form of glycogen. So whenever you are not consuming anything from outside diet, when जब तुम लोग बाहर से कुछ नहीं खा रहे हो, so that glycogen is broken to glucose. Okay, so the synthesis of glycogen also takes place in the body, and degradation of glycogen also takes place in the body. And there are basically two organs involved for this, liver and the muscle. Why muscle? Because muscle requires energy. We are walking, we are talking, you are attending the class, you are eating, every time you are using your muscles. On the other hand, liver is the kitchen of the body. So liver stores everything inside it. Always remember. जैसे कहते हैं ना कोविड के टाइम में क्या था? We used to store everything in our houses and slowly we used to consume that storage thing. Same is the case with liver. Okay, so glycogen is the reserve food in humans. So synthesis of glycogen, this is very important. Synthesis of glycogen is known as glycogenesis. Right? कहाँ पे होती है? It occurs, just now I told you, liver में and muscle. Similarly, if the body requires energy, so that becomes breakdown of glycogen. And that process is known as glycogenolysis. बेटा ब्रेन में भी होता है बट देयर द मेन रिसोर्स इज ग्लूकोज टू गिव एनर्जी. राइट नातुआ सिस्टर्स? देखो processes are occurring everywhere but slowly I'll tell you what happens is, जैसे if I talk about our brain, if I talk about heart, brain में the main source of energy is glucose. ठीक है, सो उसमें ग्लूकोज से एनर्जी आएगी बट स्टोरेज इज द लिवर एंड मसल्स बेसिकली रिक्वायर. नो, इट इज नॉट स्टोर्ड एज सच. ओके, एंड breakdown occurs in the muscle. This is important. और वो भी पता है breakdown occurs in the liver. फटाफट से this glycogen will be broken down to glucose and it will be sent everywhere. जैसे it will be sent to the brain to give energy. मसल में ग्लाइकोजेनोलाइसिस नहीं होता है. I'll tell you the reason also why. Because मसल में there is a very important enzyme which is absent. When we will discuss the metabolism, then I'll tell you. So मसल में significance क्या होती है? मसल में Cori cycle is operative. So glycogenolysis occurs in the liver. To some extent, glycogenolysis occurs in the lysosomes also. So that varies from organelle to organelle or organ to organ. Because देखो whenever we talk about metabolism, no, there are 3 stages in our body. एक होती है fed state, एक होती है fasting stage and एक होती है starvation. Right? Fed state is one well-fed state when we are having something. Fasting is when we are increasing the time gap, say 12 to 24 hours. That is fasting. But more than 24 hours, or you can say more than 2 days, it comes out to be starvation. Or starvation is basically prolonged fasting. This is just, I'm just giving you a hint. Up, if we talk about our heart and our brain, they to work 24/7. They will be requiring energy. So even if we are not consuming anything, what are the different substrates which are giving energy to the brain, to the heart? That is what is metabolism all about. That all we are going to cover up in metabolism. Okay, so that is why right now I am just discussing the chemistry with you people. So once chemistry portion is clear, then automatically we will switch over to metabolism. Okay, so this is how the defensive mechanism, that is why we call it as homeostasis also. The body tends to be in homeostasis. Negative feedback is there, positive feedback is there. ऐसा तो नहीं है कि immediately we start taking medicines. No, there is already a defensive mechanism present in the body. Slowly we switch over to that when it is disturbed. Got it now? So we can say that glycogen is the reserve food in humans. Synthesis is this, breakdown of glycogen is glycogenolysis. Now coming over, since we are discussing the chemistry, what is the structure of glycogen? So if we talk about the structure, it is branched. It doesn't have 2 forms. It cannot afford also because it is synthesized. So it is branched, that means it has both linkages, alpha 1,4 as well as alpha 1,6 linkage. Then again, it will have one reducing and non-reducing end. Ab now, what is the difference between starch and glycogen? Okay, basic difference, starch is the reserve food in plants, glycogen is the reserve food in animals. But if we talk about the structural difference is that branching in glycogen appears after every 10th to 12th residue. Now, what do you mean by this term? Just suppose if I talk about starch में linkage will be say after 20th residue, after 50th residue, after 100th residue. But glycogen may suppose if this is a linear molecule, branching will appear like this. Branching will appear like this, like this, like this. Why? Because it is being, but the structures are never asked. But yes, if you are applying for your university, like suppose if you are studying in an Indian medical college, there no doubt structures are asked. But that too structures of monosaccharides are asked, not polysaccharides. जैसे questions will be asked like this: explain alpha and beta form of glucose. Okay, then explain, you can say, mutarotation. For PG, no, structures are never asked in PG. If you are preparing for your PG exam, structures will not be asked, but yes, questions related to structures will be asked. जैसे DNL, enantiomers, simple question. The isomers who are non-superimposable mirror images of each other are known as like that. And similarly, this question is a PG question which I am discussing, that in glycogen, the branching is extensive or intensive. Yes, if you are a first year student, definitely beta structures are asked. And if you are studying in an Indian medical college, yes. Because I am telling you questions kaise aate hain. I have given you the example that what are anomers? Explain with the help of structures. This is a very frequently asked question. What are enantiomers? Explain with the help of structures. But only the structures will be asked of monosaccharides, not polysaccharides. This is what I am telling you. But yes, PG में ये question आता है. PG में the question is asked like this कि branching in glycogen is intensive, so it appears after. So the options will be 10 to 12th residue, 30th to 40th residue, 50th to 60th residue, like that. Is it clear? Zainab and Natua sisters? जैसे suppose if I write a question here, देखो, since you have asked this, so I'll just है ना. So देखो, for first year students question ऐसे आता है, define anomers, okay, with examples. अब suppose if this question comes of 5 marks, then you have to explain. No, anomers क्या है? I told you differ at C1. Right? Examples are alpha and beta forms of D-glucose. So if you write the structure, it becomes, the answer only becomes more appealing and you will get good marks. You'll get full marks in fact. And whenever you write structures, chances of getting full marks are there. Okay, similarly epimers maybe you can write the structures. Right, mutarotation maybe you can write the structure, and I told you yesterday clearly, and I've shown you the structures also. Alpha is when hydroxyl group is placed downwards, beta is when hydroxyl group is placed upwards. So these are the questions which can be asked. And glucose का structure तो बेटा वैसे भी you have studied, you know, in your 11th and 12th class. So I think it is easier to remember that structure. And regarding PG, this is a question. So I can say that branching in glycogen will appear after every 10th to 12th residue. And the way I am teaching you people is, I am considering that this is for first year students also. This is for, I should say, students who are preparing for their PG also, students who are preparing for their FMGE also. In fact, students who are from different disciplines also, be it MBBS, be it BDS, be it physiotherapy. The only difference is detail. It is detailed. And if you study through my notes and you consult any of the basic books, your biochemistry part will be sure and short done. Okay. And since obviously it is an online session, you can see my face, so you can ask your any doubts if you have, because what are we here for? We are here to clear your doubts, right? So glycogens may, you can say, branching in glycogen appears after every 10th to 12th residue. Yeah, for first year students, I would recommend DM Vasudevan, number one. Okay, then second, you can go for Satyanarayana, you can go for Dinesh Puri. These are all very good books. And if you want to go through the Bible of biochemistry, that is Harper. Harper is the Bible of biochemistry. So that depends on you. If you want to go in complete depth, consult Harper. Otherwise, Vasudevan, DM Vasudevan, Satyanarayan Chakrapani, MD Rafi, Dinesh Puri, all are very good standardized books on biochemistry. Right? So this is glycogen. Clear? Then after glycogen, then third glucosan was cellulose, and then dextrans and dextrins. Okay. Then we come over to cellulose. And one more thing I just wanted to tell you. Just starch gives blue color with iodine, no? Glycogen gives red color with iodine. Physiologically, we don't give glycogen in the practicals, but still, it will always give red color, not blue color. Okay? So then comes cellulose. Now, cellulose is a linear molecule, very important, and it has beta 1,4 linkage or glycosidic bond. Basically, COC is a glycosidic bond. Right? Now, if we talk about what is the importance of cellulose, the cellulose is a very, very important insoluble dietary fiber. Okay, now what is insoluble? What is dietary? What is a fiber? Nowadays, people are mad to be fit, isn't it? Or वैसे भी normally what we say is कि if you are dieting, so you should have a fiber-rich food. Similarly, if you are suffering from any ailment, be it diabetes, be it overweight, obviously if you go and consult any dietitian, he or she will recommend you to have dietary fibers in the diet. So what is the significance of these dietary fibers? And these dietary fibers are basically of two types. एक होते हैं soluble and one is insoluble. So what is the difference between soluble and insoluble? It is clear from the word itself. Soluble जो soluble होगा, insoluble जो soluble नहीं होगा. Clear? So if we talk about soluble, pectins are there, gums are there, mucilage is there. And if we talk about insoluble, the most important one is this cellulose. Right? Up, what is the significance of cellulose? It cannot be digested in the body. Say for example, if we consume more of salads, radish we take, carrot we take, they are always good for health. Why? Because these cannot be digested. They act as a roughage in the diet. This is important. So they are acting as a roughage. So roughage का function क्या हो जाएगा? Roughage will simply, what will be the function? ये सिंपली क्या करेगा, इट विल इंक्रीज द पेरिस्टाल्टिक मूवमेंट्स इन द बॉडी एंड इट विल रिलीव अस फ्रॉम कॉन्स्टिपेशन. So basically relieves from constipation. This is the most important significant feature of cellulose. Okay, and again, if it is relieving us from constipation, you know, other features are what? It decreases glucose level also. So it is advised for diabetics, right? Then it decreases cholesterol level also. So it is again good for people who are hypertensive. So you can just imagine the significance of cellulose, that even though it is not digested in the body, then also it proves to be a very important digestive tool in the body, just because of one plain and simple reason, that it is required as a roughage and it helps us from preventing from constipation. So this is cellulose, which is what? A glucosan. Clear? Then after cellulose, we come over to dextrans. अब देखो, ये जो डेक्स्ट्रान्स होते हैं ना, दे आर द मेश्ड अप फाइबर्स. मेश्ड अप है बिकॉज इसमें सो मेनी लिंकेजेस आर देयर. इफ वी टॉक अबाउट alpha 1 4 will be there, alpha 1 3 will be there, alpha 1 2 will be there. So it forms a mesh like that. Okay, अब चलो, mesh of what? Glucose only. Now what is the significance of dextrans? They are used as plasma expanders. They are used as plasma expanders. Now what is the significance of this? कि expand करते हैं plasma को. So what happens is, for first year also I'll tell you ki how to get the lectures. Otherwise keep on attending the lectures here, so automatically, and otherwise you can subscribe to my Telegram channel also, and I will share the link after this class, right? So dextrans की significance क्या है? They are used as plasma expanders and they are basically given to treat the patients with hypovolemic shock. Basically, abhi right now you won't be able to understand this terminology, but in a layman's language, hypovolemic shock. Hypo means decrease in the volume. Whenever there is a decrease in the volume, we always need to have that thing which has to be injected intravenously to expand the plasma. Okay, वॉल्यूम कम हो गया है तो उसको हमें एक्सपैंड करना है, तो उस एक्सपेंशन के लिए डेक्स्ट्रांस आर गिवन. तो डेक्स्ट्रांस क्या करेंगे कि जब कम हो जाएगा वॉल्यूम तो उसको एक्सपैंड कर देंगे. दैट इज व्हाई दे आर द प्लाज्मा एक्सपेंडर्स एंड दे आर गिवन टू ट्रीट द पेशेंट्स विद हाइपोवॉल्यूमिक शॉक. राइट, this is the significance of this. And after dextrans we come over to dextrins. Now if we talk about dextrins, dextrins are simply bigger units of maltose. That's it. Units of maltose which are used in digestion. So we can say that dextrins are hydrolyzed by dextrinase enzyme. That's it. But since it is a glucosan, why it is a glucosan? Because it is formed of glucose molecule only. And then last but not the least are chitins. Now if we talk about chitins, they are basically present in the exoskeleton of arthropods. Okay, and they have basically N-acetyl glucosamine. Yes, insects, correct. Very good, Zainab. N-acetyl glucosamine. But again, they have glucose. So these are the most important glucosons which are present in the body. Okay, and then after this, we come over to fructosons. And if we talk about fructosons, fructosons are what? Identical isomers of fructose. That is why they are fructosons. An example is inulins. And we can say that if we talk about inulins, the only function, they were isolated from the roots of dahlia flower. And the function of inulins is that it is required for the estimation of GFR. GFR, yes, very good, Zainab, glomerular filtration rate, and the name of the test is inulin clearance test. Inulin's clearance test. So these are the fructosons and glucosons. So they will come under the class homopolysaccharides, homo means identical. Right? Till here it is clear to all of you? Right? Now we will take 5 minutes break, and after 5 minutes break we will be starting up with the heteropolysaccharides. Clear? So in this break you can just refresh yourself, because I know it is difficult to retain everything, right? To just take a break for 5 minutes and then we will start, right? Yes. So let's resume the session. Right. Well, my voice is clear, beta? Okay, right. So after these homopolysaccharides, then we come over to heteropolysaccharides. Clear? Now, if we talk about heteropolysaccharides, now till here it is clear to all of you. If yes, then you can just give a thumbs up to me. Vrush, Zainab, if it is clear, you can give a thumbs up to me. Right? So hetero means non-identical units are there. Clear? Non-identical units of what? Carbohydrates will be there. Clear? Now what are these non-identical units? So these non-identical units are, can you see me better? So non-identical will be, it has, okay, it has amino sugars, right? And it has uronic acid, very, very important. So I can say that amino sugars are there and uronic acids are there. So what do you mean by amino sugars? What are the examples? So examples are glucosamine, right? And galactosamine. Now, are you understanding? Like if I ask you, Shilpa and sisters, see, because you know this type of question can also be asked in the exam. What is this glucosamine? What is this galactosamine? So, glucose, which has amino group attached to it, it is glucosamine. Galactose, which has amino group attached, it is galactosamine. And uronic acids are glucouronic acid. Very, very important. I told you, can anybody now tell me glucouronic acid is produced by which pathway in the body? Because yesterday only I discussed that. Let me see. What is the source of glucouronic acid in the body? Beta, gluco. Dekho, it is clear from the word itself. Gluco. That means the source has to be glucose by uronic acid pathway, which we will be studying. Don't worry, uronic acid pathway we will be studying also, right? So glucouronic acid is produced by a very special pathway in the body, which is glucouronic acid pathway. or uronic acid. And second is idouronic acid. So I can say that glucouronic acid and idouronic acid are linked as isomers with respect to one. Okay, glucose है तो glucouronic acid, idouronic acid will be an isomer of this. So these are heteropolysaccharides, and you know what are the properties of this? Yes, very good, beta, uronic acid. So what are the properties? They are very, very important. Negatively charged polyanions. They are the negatively charged polyanions. And the most important thing is that they act as lubricants. They act as lubricants, shock absorbers. Right. And since they act as lubricants, shock absorbents, they are present in, very, very important, present in the connective tissue, in the cartilage, right? And just because they are acting as lubricants, we call them as mucopolysaccharides, also known as muco, because wherever mucus is there, you know, mucus, that viscous fluid is there. Just if I talk about the synovial fluid in the joints, so basically it helps in that movement of the joints. So what is filled inside? Mucopolysaccharides. Mucopolysaccharides जिनमें क्या present है? They have amino sugars and they have uronic acid. So also known as mucopolysaccharides. And since they have glucose, which is aminated, means amino sugar, so they are also known as glycosa, very, very important, aminoglycans, or commonly we call them as GAGs, glycosa aminoglycans. Clear? And if we talk about the examples, सबसे पहले देखो, what are they? They are simply the negatively charged polyanions, because we know whenever we talk about a cell membrane, we know cell membrane is selectively permeable. Why? Because it will allow only selective molecules to pass through it, and that is why it has a charge, because it will allow only certain molecules. Then it acts as a lubricant and acts as a shock absorbent. Since they are present in the connective tissue, they are present in the cartilage, they were first isolated from the cornea. Right? So, they are known as mucopolysaccharides. And due to their composition, they are also known as glycosa aminoglycans. And what are the characteristic features? They can have sulfate with them. It depends. If they have sulfate, again, they will have charge. They can have acetyl group with them. So many things are there. So I can say N-acetyl glucosamine. I can say N-acetyl galactosamine. I can say N-acetyl glucosamine 4-sulfate, like that. So again, structure of this is never asked in the exam, so you don't have to worry about this part. Structure won't be asked, but still I will just show you the structure, how it looks like, so that you will have an idea. Suppose वैसे structure has never been asked, but चलो I'll just give you rough idea कि कैसे होता है ये. Right? जैसे suppose if I take the example of this. ये say for example heparin. क्या है? Heparin is a mucopolysaccharide. This is one example. So heparin has glucosamine, right? sulfated. Why? Because it has charge on it. Similarly, it has iodouronic acid, which is also sulfated, like that. And it has this type of linkage. So this is one example of your mucopolysaccharide. Got my point? So question कैसे आता है exam में? The question which is asked in the exam is write a short note on mucopolysaccharides along with the examples. Okay, so what are mucopolysaccharides? The polysaccharides which are non-identical units of glucose, which comprises of amino sugars, which comprises of uronic acid. Amino sugars can be glucosamine, can be galactosamine, which are linked with either glucouronic acid or iodouronic acid. And if I talk about the examples, so many examples are there. For example, hyaluronic acid. Right? Similarly, heparin, which is a very important anticoagulant. I'll show you what are the composition of this. Then you can say heparin sulfate. Right. Then you can say chondroitin. These spellings beta you have to learn. Chondroitin sulfate. Dermatin sulfate. Like dermatin sulfate. So these are the examples of mucopolysaccharides. And I'll just show you the composition of this. This is a very important chart which you people should know. Right? Now see, if I talk about hyaluronic acid. Okay, what are the units? It consists of N-acetyl glucosamine and glucouronic acid, as you can see here. Right? What is its location? Where it is located? So it is located in the skin. I'll just elaborate it like this. Okay, so it is located in the skin, synovial fluid, the bones, cartilage, and the loose connective tissue. So you can say this is what is hyaluronic acid. Clear? That is what I have written. The examples also hyaluronic acid. Then second is chondroitin sulfate. If we talk about chondroitin sulfate, it has N-acetyl galactosamine and glucouronic acid. And it is present in the cartilage, in the bones, and in the central nervous system. And chondroitin sulfate is the most abundant mucopolysaccharide. Right? Hyaluronic acid is without sulfate. Only mucopolysaccharide without sulfate. Then if we come over to keratin sulfate also is a very important mucopolysaccharide. Why? Because it was first isolated. The first mucopolysaccharide to be isolated was keratin sulfate, and it was isolated from where? From the cornea. Right? And second important feature is only mucopolysaccharide without uronic acid. This is the only mucopolysaccharide which does not have uronic acid. Otherwise, if we talk about hyaluronic acid, chondroitin sulfate, everywhere either iodouronic acid is there or glucouronic acid is there. And if you see the composition here, it has N-acetyl glucosamine and galactose is there, which means no uronic acid. So suppose if I ask you what is the name of that mucopolysaccharide which is without uronic acid, so what's your answer? Your answer should be immediately keratin sulfate. And always remember beta, it is keratin, not keratin. Keratin nahi hoga. Keratin is a protein and keratin is a mucopolysaccharide or a carbohydrate. Then it is isolated from cornea, cartilage and loose connective tissue. Again, this is a very important feature. Then if we talk about heparin, can anybody tell me what is the role of heparin in the body? Let me see. What is heparin? Zainab is there. Can you tell me beta, what is this? What is the function of heparin? Heparin is a natural anticoagulant. Very important. Okay, so heparin is the most important anticoagulant, and if we look at the composition, it has glucosamine and isouronic acid. Right, then comes heparin sulfate. Heparin sulfate is present mainly in the basement membrane of the kidneys. Very important. Heparin sulfate. Heparin sulfate. What is its significance? That it, yes, very good, Zainab. It is a very important anticoagulant. Now, if we talk about heparin sulfate, it lines the basement membrane, and you know, basement membrane, and it is actually negatively charged. It has negative charge on it. So obviously, if it is lining the basement membrane of the kidneys, it is negatively charged, so it will not allow albumin to pass through it. So this is an advantage. So ये क्या करेगा? ये albumin को pass नहीं होने देगा. So I can say that it will not allow negatively charged albumin to pass through it. Charged albumin to pass through. So this is one of the very important feature of heparin sulfate. So see, now you better see the spellings. Heparin sulfate, heparin. Heparin is an anticoagulant, if you see here, and heparin has isouronic acid. And heparin sulfate is a basically negatively charged, which is lining the basement membrane of the kidneys, and it is having glucouronic acid. This is the main difference here. Got my point? And then comes dermatan sulfate. Dermatan sulfate is present mainly in the skin. Derma means skin. So dermatan sulfate is widely distributed in the skin. Okay, so these are what? These are the very, very important mucopolysaccharides. Is it clear to all of you? This is very, very important. बहुत important है. Right? The major ones are, if I have to summarize, heparin, heparin sulfate, chondroitin sulfate, keratin sulfate, hyaluronic acid and dermatan sulfate. Right? And if I have to enlist the main points about them, I can simply say that what are the main points? सबसे fun, if I ask you non-sulfated mucopolysaccharide is, now you are going to answer non-sulfated mucopolysaccharide. Can anybody answer? Similarly, mucopolysaccharide without uronic acid. Now you tell me, what is the example of a non-sulfated mucopolysaccharide? Means I want you to name that mucopolysaccharide which does not have sulfate. Yes, just give it a try. Anyone, beta? Okay, I'll give you an example. Non-sulfate mucopolysaccharide is hyaluronic acid. Just now I told you, no? Hyaluronic acid. And yes, very good. And mucopolysaccharide without uronic acid is? Yes, Zainab. What will be the answer to mucopolysaccharide without uronic acid? You have to learn it. Keratin sulfate. Clear? Right? So ये क्या हो गया? These are your mucopolysaccharides or heteropolysaccharides or GAGs. Right? Now after this, we come over to what is the clinical correlation of this. Right? Now, beta, now Zainab, I just want to correct it. It is keratin. TAN. Always remember keratin is a mucopolysaccharide ton and keratin is a protein. There is a difference between keratin and keratin. क्या difference है? Keratin is a mucopolysaccharide. Keratin is a protein. Hardest protein, I should say. Right? Very important again. Now we are going to study the clinical correlation of this. Very, very important. Now, what do you understand by the term clinical correlation? Okay, I'll just ask you one common example. A plus B in the presence of an enzyme is forming C. Okay, A plus B in the presence of an enzyme is forming C. Suppose if I say this enzyme is absent, whose concentration will increase? Suppose if an enzyme is absent, whose concentration will increase? Can I say the concentration of A and B will increase? My simple question is, if something is forming this, if an enzyme is not there, or if I take vice versa, if C is there, for example, so C is in the presence of an enzyme, same I am asking you, A plus B. So if enzyme is absent, the concentration of C will increase. Right? So always remember, beta, whenever the concentration of anything increases, it increases in two things. Ek to it increases in the blood. Okay, I'll tell you after this. First of all, just listen to this, then I'll tell you okay, how long. Because your class timing will be 11 to 1. Every day 11 to 1, I will take your biochemistry classes. Yes. Yes, right, Zainab. Either A or B will increase or C will increase. So they will always increase in blood or they will increase in urine. Yes, very good. अब होता क्या है कि when they increase in blood and urine, as a doctor, we are able to diagnose that. Right. So whenever something increases in blood, emia is added as a suffix. And when it increases in urine, urea is added as a suffix. अब यहाँ पे क्या है? In case of this, we can say that if a mucopolysaccharide, ठीक है, it is broken into A plus B plus C, and if this enzyme is absent, there will be accumulation of mucopolysaccharide. Okay, so we call this as mucopolysaccharidosis, and it is followed by excretion of gags in urine. So we can say that mucopolysaccharidosis is a class of disorders where how the diagnosis is made when there is excretion of glycosaminoglycans in urine. What my point? So that is what we are going to study here. So this is the clinical correlation, and what is this mucopolysaccharidosis? So always remember one thing, right? These mucopolysaccharides are synthesized. कहाँ पे? In the endoplasmic reticulum and the Golgi complex. Okay, synthesis occurs in the endoplasmic reticulum and Golgi apparatus, and degradation occurs in the lysosomes. Right? Because we know that lysosomes are the suicidal bags of the cell, right? So now see, since they are synthesized in the endoplasmic reticulum and Golgi apparatus and they are degraded in the lysosomes, suppose if the enzyme is absent, mucopolysaccharides will start accumulating and they will be excreted in urine. So that collection of disorders is known as mucopolysaccharidosis. So I can say that since they are synthesized in the endoplasmic reticulum and Golgi complex, their degradation occurs in the lysosomes. Now, absence of hydrolysis enzyme. So enzyme is hydrolase in lysosomes will lead to lysosomal storage disorder, right? Which is nothing but mucopolysaccharidosis. I'll just repeat it again, that mucopolysaccharides are synthesized in the endoplasmic reticulum and Golgi complex, right? Whenever they have to undergo degradation, they will go to the lysosomes. And in the presence of hydrolytic enzymes, it will be hydrolyzed. But if that hydrolase enzyme is absent, it will lead to accumulation of these mucopolysaccharides and it will lead to excretion of them in urine, gags in urine. So this we call it as mucopolysaccharidosis, right? And these are known as lysosomal storage disorders. Now, what are the clinical features associated with a person suffering from mucopolysaccharidosis? So, clinical features इसमें सबसे important क्या होते हैं? They have a frontal bossing, means prominent forehead. I'll show you the picture also. Prominent forehead. I'll show you the picture. See. You can see, right, this child has a very prominent, very big forehead like this. Okay, then you can say large head also, right? Then they have a depressed nasal bridge. Depressed nasal bridge. You can see that depression is there. Then mental retardation is there. Mental retardation. Right? Then another important, मतलब they look like Mongols, you can say. And ना hands और feet ना ऐसे claws बना लेते हैं. Clawing of hands is there. Clawing of hands. इसको हम बोलते हैं डिस्टोसिस कॉम्प्लेक्स. डिस्टोसिस कॉम्प्लेक्स मीन्स क्या होता है कि बोन्स आर डिसफिगर्ड. कोई पर्टिकुलर बोन होगी जो ना डिसफिगर हो जाएगी. द बोन्स आर नॉट प्रॉपरली ग्रोन. सो दिस इज ऑल्सो नोन एज डिस्टोसिस कॉम्प्लेक्स. And there will be a copious nasal discharge, means always there will be a discharge from the nose. So that is a very, very thick viscous fluid will start coming from the nose all the time. So it is copious nasal discharge. And the most important feature here will be cloudy cornea, or you can say that vision will not be clear. I should say that हम उसको बोल देते हैं corneal clouding, or it is also known as defective vision. But it occurs, see, I'll come to that, Vrush. It should not occur from the embryonic age, because whenever we talk about any, mode of inheritance, you must have studied in class 12, जैसे autosomal recessive is there, X-linked is there. So that depends what kind of inheritance is this. Got my point? जैसे autosomal recessive है, recessive will express itself only when it is present in homozygous. Otherwise, heterozygous may it never expresses itself. If I say any disease has autosomal dominant type of thing, so dominant will dominate. Okay, so it depends because now, whenever I am talking about any disorder, I will always mention the mode of inheritance with you. So mode of inheritance is very important to understand. Got my point? This is X-linked is there, Y-linked is there, then maternal inheritance is there, then you can say autosomal recessive, autosomal dominant, so many, 5 type of inheritance are there. Okay, so corneal clouding or defective vision is there. एक और इसमें होता है pain in the groins, in the pubic area, around the pubic area. So pain in the groins also will be there. Right? And then it might lead to, because again bones and all are disfigured, so there is umbilical hernia also. So these are some of the important characteristic features of a person suffering from mucopolysaccharidosis. और diagnosis तो ऐसे होगा, or laboratory diagnosis, how the laboratory diagnosis will be done? Simply gags will be excreted in urine. Gags excreted in urine like this. Okay, after this, now, Rush, I will come to your point. What is your question? First of all, just try to understand what are the different type of mucopolysaccharidosis. Now, for understanding that, we can say that type 1H is there. Okay. Type 1S is there. H is Hurler's syndrome. This you have to learn better. Hurler's syndrome. Right? Type 1S is Ski syndrome. Then if we talk about type 2, type 2 is Hunter's syndrome. Type 3 is Sanfilippo syndrome. Right? Type 4 is there and type 6 is there. There is no type 5. Right? Type 4 is Morquis. Okay, right. Always remember this beta because every disease has its mode of inheritance. Once I finish up with this, definitely I would love to take that topic also with you. I mean, like, what is the mode? Mendelian inheritance is there, non-Mendelian inheritance is there, everything is there. And type 6 is Marotuex Lamy syndrome. Okay, so these are the different type of mucopolysaccharidosis. Up, what you have to learn here first of all, okay, what are the main points? Now coming over to Vrushali's point, always remember all mucopolysaccharidosis. This is very important. Mucopolysaccharidosis are autosomal recessive. Okay, autosomal recessive except Hunter's syndrome. Okay, so Hunter syndrome is what? Hunter syndrome, which is XLR, which means it is X-linked recessive. So it is the general characteristic of X-linked recessive mode that it is present only in males. Females में नहीं होता है because males are what? Males are heterogametic, females are homogametic, isn't it? So if females are homogametic, it is recessive. It won't be expressed. But in males have only one X, heterogametic hai, so the male will be diseased. Got my point? So all mucopolysaccharidosis are autosomal recessive except Hunter syndrome, which is X-linked recessive. Now, coming over to the deficient enzymes here. What are the deficient enzymes? Now, these again you have to learn because some things you have to learn. Okay, so if I talk about Hurler syndrome, the deficient enzyme is alpha L iodouronidase. Right? If I talk about Ski syndrome, again the deficient enzyme is alpha L iodouronidase. If I talk about Hunter syndrome, in Hunter syndrome, the deficient enzyme is iodouronate sulfatase. If we talk about Sanfilippo, it is basically dermatan sulfate, so the enzyme is heparenesis. Type 4 में it is galactosamine 6 sulfatase beta galactosidase. I'll just second galactosidase. Okay. And in Marotuex Lamy syndrome, it is N-acetyl. Again, galactosamine 4 sulfate. Okay. Now, enzymes you have to learn. So, if I have to summarize, I can simply say that type 1H is Hurler's syndrome. The deficient enzyme is alpha L iodouronidase. Type 1S is SCI syndrome. The deficient enzyme is the same, but if the deficient enzyme is the same, the features will be different. हमारे पास suppose if a patient comes to us, always remember when you are going to become doctors, सबसे पहले हम क्या करते हैं? We are going to take obviously the name, we are going to take the history, and then we are going to examine the patient. That examination of the patient is very important. How his face is looking like, which are the prominent features which can be quite evident by looking at the face only. So then we have to prescribe to some tests. So this all is a very laborative procedure, very laborious procedure. Then only we can make some diagnosis. Okay. So type 1S is this, then type 2 is Hunter's syndrome. The deficient enzyme is iodouronate sulfatase. Type 3 is Sanfilippo. The deficient enzyme is enzyme which degrades your heparin sulfate, so it is heparinases. Type 4 is Morquis. The deficient enzyme is galactosamine 6-sulfate beta-galactosidase. And then comes type 6, Maroteaux-Lamy syndrome, where N-acetyl galactosamine 4-sulfate is there. Okay, so these are the general features. Now, I told you clinical features are more or less the same. Whenever a patient comes to us, he has a prominent, forehead. He is complaining of pain in the joints and in the groin area, in the reproductive area. Then he is suffering from hernia also. When we palpate the abdomen, we can then his fingers are like this, clawing of hands is there. So many reasons are there which can give copious nasal discharge, which can give an indication that the patient might be suffering from mucopolysaccharidosis. Then we examine the urine. If gags are eliminated, then we can go for enzyme studies, and these are the deficient enzymes which will be there. Now there are two main features by which we can differentiate them. And what are those two? One is your mental retardation. Very, very important. I'll just give you a hint also of this, how you have to remember this. I'll write the disease here because enzymes I have already written there. So, one is your mental retardation. And second is, the most important one is corneal clouding. Corneal clouding means there will be formation of clouds around the cornea, so the image would be hazy. Okay, so if I talk about type 1H, always remember mental retardation is present, right? And corneal clouding is also present, right? Then if we talk about type 1S, SCI syndrome, SCI mein mental retardation is absent. Means he will have a normal intelligence in SCI syndrome, but corneal clouding will be present. Vision to defective hogi, but developmental, you can say mentally he will be sound. The normal intelligence level will be there. Then type 2 is Hunter syndrome. I'll just write here also it is X-linked recessive. Type 2 mein this is present, but this is absent. Very, very important. Type 2, a patient who is suffering from Hunter's syndrome will have no corneal clouding or vision will be clear. And if we talk about type 3 is Sanfilippo, where again this will be present and this will be absent. And if we talk about type 4 and if we talk about type 6, because type 5 I told you it is not there, mental retardation will be absent here, will be absent here, but corneal clouding will be present. So this table you have to learn. This is a very important table. Here what I have told you is कि देखो Mucopolysaccharides में I'll show you one more slide also. So mucopolysaccharidosis, most of the symptoms are similar, but there has to be a difference in one or two of the symptoms. So if I talk about type 1H, which is Hurler's syndrome and Ski syndrome, because the enzymes are the same. Okay, so if the enzymes are same, but the difference is that corneal crowding is present in both, but Ski syndrome wala patient is intelligent, means he is not mentally retarded, whereas this Hurler syndrome wala is mentally retarded. Clear? Then if we talk about type 2 is Hunter's, type 3 is Sanfilippo's. Here you can say vision is clear, but mental retardation is there. He is not properly developed. Mind is not developed. And if we talk about type 4 and type 5, mental retardation is absent, but this is present. And iske liye you can remember this mnemonic: Sam goes for hunting. Okay. SA stands for Sanfilippo's, right? And HNT stands for hunters. अब देखो, Sam can only go for hunting when his vision is clear, isn't it? Anybody can hunt only when the vision is clear. If you can't see anything, how can you hunt? कैसे मारोगे किसी को जब तुम्हें दिखेगा ही नहीं? Okay, so always remember. अब देखो क्वेश्चन कैसे आता है. Suppose if a patient comes to you, right? He's 2 years old or 3 years old, he's 6 years old also, and he is having all the symptoms, but the only thing is that his vision is clear. So if his vision is clear, then your simple mind will go to vision is clear, rest are, he's suffering from mucopolysaccharidosis, gags is also there in the urine of that patient. So you can say either he's suffering from Sanfilippo's or suffering from Hunter's, because vision is clear. Getting my point? And now if a male is there, then sure and short it is Hunter syndrome. That is what I told you, na? Hunter's is X-linked recessive. What my point? So this is how you can make your diagnosis. This is very important. Then after this, then there are certain other characteristic features also. If we talk about visceromegaly, visceromegaly is basically visceromegaly. It is basically enlargement of a particular, enlargement हो जाता है. Why? Enlargement due to accumulation of mucopolysaccharide. A mucopolysaccharide. So there are certain features which vary from different mucopolysaccharidoses. So जैसे if I talk about short stature, I'll just write it here. Again I will write type 1H, 1S, type 2, type 3, 4 and 6. Okay, these are the mucopolysaccharidoses which we have studied. So if I talk about visceromegaly, it is present everywhere except 4. In present, absent. So wherever it is accumulated, it will show the enlargement of that organ. Okay, similarly short stature. Short stature means height short, because dystosis complex is there, no? So it will be present in all. It will be present in all. Right? Similarly, if I talk about dystosis complex, it will also be present in all. Right? And if I talk about, these are the main ones. फिर एक rally bodies होती हैं in the blood. So Rayleigh bodies भी present होती हैं in all except this fourth. Right? So this is the comparative, I should say, statement of all the mucopolysaccharidosis. Now coming over to what can be the treatment. Agar if somebody is suffering from a disease, there has to be a treatment also. So mainly treatment is enzyme replacement therapy. Enzyme replacement therapy is available. Right. Jesse, we can say Nagalazymes are there, then Elaprase is there. These are the different types of enzymes. L-durazyme is there. So these enzymes can be synthesized outside and they can be inserted in a patient. If he, accepts it, so automatically it can be treated. Okay. So here we finish up with the chemistry of carbohydrates. I hope the chemistry part is clear to all of you. And regarding the classes, beta, schedule of the class will be 11 to 1. So if you guys have any problem related to the timings, you can tell me so that I can shift the schedule of the classes also, because I want maximum number of students should attend the class. Because maybe morning time is a little bit vague, maybe due to holidays, yeah, due to vacations, you guys must be getting up late only. So we can schedule the classes in the evening also. No issues about that. And regarding Dilkush, are you there? So regarding the material, I will just share the material in the group. And this is I'll just write about my Telegram group also. My channel name is this. Right? And if you have any queries, you can ask me. This is my number. I hope till here it is clear to all of you. So if there is no problem, everything is clear, then we will be winding up with the session. And you can just set it your schedule from 11 to 1 daily. You will have your biochem class. And if you have any issues regarding the timing of the class, just let me know so that I can alter the timings. Okay. So let's wind up today's session. Right. So see you guys tomorrow, same time. Bye-bye.